Hey everybody, guess who's back? I know it's been like a crazy long time since my last video. I think that one was sometime late July. Now it's February. Yeah. I'm not even gonna make excuses as to why I didn't make videos. I did make one photo update. In the meantime, I'll put a link in the description. But basically why I'm back with another video is that kind of between the last video and now, in terms of my chest, there has not been much change or progress, or however you want to call it. I did go back to work in August, and I had my checkup on September 13th with my surgeon, and he decided that everything was healing well. There were some issues, namely with how tight and restricted my chest was. Everything kind of felt just stuck together. And on that note, I got myself physical therapy for my chest. I didn't even know that was a thing. I kind of came by this information through unofficial channels, but I've been going there for I went for over 3 months, I think. What they did was just massage the tissue and use this small wooden stick to kind of break up the scarring underneath the skin that was making my chest so tight. And it's worked wonders. It's gotten much better. There were some issues, however, that even physical therapy couldn't resolve, and that is why this past Monday, which is 4 days ago, on January 29th, I had revision with my surgeon. Now, the way it was explained to me in advance by him was that this would be like a very small, very quick outpatient procedure, that it wouldn't be a big deal. 15 minutes in and out, and basically, from what I understood, it would mean that I could go straight back to work. So that is how he presented, or that's how I understood what he was saying. When in fact, what it turned out to be was just the same procedure on a smaller scale. And definitely it was really under local anesthesia, which was really weird. It is really strange to be awake for something like that. I actually remember thinking when I lay down on the operating table, I was wearing my own clothes, or my pants and my boots even. But I remember when I was lying down, I was wondering if I was going to be able to, keep my cool about this, or, once this procedure starts, what if I freak? What if I, panic? I'm not generally prone to panic attacks, but I'm human, lying there having your chest, worked on like that. It could trigger something, but luckily that didn't happen. So what they did, again, from what I understand, from a layman's standpoint, is they cut out the scars around the nipples. I asked them to make my nipples, my areolas, a little smaller still. Also because, from what I've noticed from the first time until now, is that they stretched a little. They deformed also. They were very round at the beginning, or one of them was almost like a perfect circle and the other one was a little oval. I remember that kind of bothering me at the beginning, but then by the end of it, they both got bigger, and they weren't so regular in shape anymore. Even though I think I really did try to make sure to not overexert myself and to give my body the chance to recover as well as possible. I guess these things just happen. So I asked them to make them a little smaller, and if they stretch again, hopefully, it's not going to be that big. But from what I could tell and what I felt was that they cut the scar tissue under my skin. That's at least what it felt like. I felt this tugging where they kind of were lifting up my skin, and then he was using scissors and there was this snipping sound, and then the tension was kind of releasing. So from what I can tell from that sensation is that they cut the scar tissue that was kind of holding my upper layers of the skin to my chest muscle, to just kind of free that. And there was also some residual fatty tissue left. More of that was on the left side than the right, so they did liposuction on both sides to get that out, because I had this pocket kind of here under my arm, which was really obvious in comparison to the other side, how much more tissue there was, so they took care of that. I haven't yet been able to really see what it looks like. I did have a checkup on Wednesday, basically 2 days after my procedure, and they did take off. I have to wear the binder again, so yay, binder's back. But I got to take off the binder, but there were bandages over my nipples, or like the general area around my nipples, and other than seeing that they were completely drenched and soaked in blood, once they took them off, the steri strips underneath were all covered in blood again, so I couldn't really tell. I couldn't see the edges of the areolas, so I can't tell what that looks like. I have another checkup next week. Maybe I'll get to see a little more. Again, this is my personal opinion, but I have a feeling that fluids are building up again, because when I touch my chest, it feels like a water balloon. I can't explain this better. It's just like when I touch the surface, it's very soft and like there's fluids moving around underneath. So I'm pretty sure that if that doesn't resolve on its own, I don't even know how it possibly could, where this blood could go, they're gonna have to drain it again with a big ass needle. I told my doctor about this on Wednesday, and he didn't seem too concerned. He said that we're not touching it now, but if need be, we'll do it next time or in the future. So yeah, I don't really know much more than that. I hope it all went well. I'm really nervous. I realized that I was possibly more nervous before this revision surgery than I was before the first one, and I think the reason is because, you know, from pre-op to post-op, no matter what they did, it was going to be an improvement, right? I was going to get rid of my previous chest, and I was going to be flat-chested, and that's going to make all the difference in the world, and it did. And, you know, now I already kind of had this flat chest, and while it wasn't perfect, I did say this several times, that if I had to live with the kind of chest I had after my first surgery for the rest of my life, I would gladly do it. It wasn't perfect. There were some things that did bother me when I looked in the mirror, but overall it wasn't something that, you know, would be causing me dysphoria or making me very sad or upset. You know, whereas now I kind of put a lot of hopes into this, like it was like a promise of something better, for lack of a better expression. And I'm just worried that I hope I didn't get my expectations too high, and I hope the results don't not match my expectations. So I'm really trying to curb my enthusiasm here, and just, you know, I keep telling myself that even if it's the way it was before, I'm okay with this. I don't want to get too excited, because I want to spare myself the potential disappointment in case it doesn't exactly look perfect. Because since I've had surgery, I've seen results of several other trans guys here. You know, the surgeries were performed by the same doctor. It was the same procedure, and they all had smaller chests to begin with than mine. And rationally, I keep telling myself, you know, I have to take that into consideration, that their predispositions were different, and that's why the results can look so damn amazing. And, you know, they look, to me, they look perfect. They look like that's exactly how it's always been. And, you know, for me, looking at that kind of chest would mean never even considering that there was anything done to it, or like, it's very cis-passing. And I know that's not everybody's goal, and I can't really say it's my goal, but it is a wish. And I just felt that looking at my chest, it definitely was not cis-passing. It was, you could see something's been done to it. And again, if I had to live with that, if I had to make do with that, I would, and I will, should that happen. But I guess a part of me right now is still hoping that, you know, I'm gonna get one of those chests in the end. But that being said, if in order to do so I would have to undergo another surgery, I don't really think I would go that far. I think this is possibly, in terms of top surgery, unless something goes really drastically wrong, this is probably it. I'll take whatever comes out of this, and that's gonna be it. Overall, I'm happy with the progress. I'm not in much pain, or really hardly any. I was in pain the first day, the day I was operated on and discharged. I took several painkillers, and I was thinking why it hurts more this time than I remember it hurting originally, since that was a much more invasive procedure. But then I realized I spent 5 days in the hospital after my first surgery. I barely moved at all. So, you know, this time it was different because after an hour or two of observation, they sent me home. So I had been moving, I had been walking, I had been sitting, I'd been straining myself more than I did the first time. So obviously I was feeling the consequences a lot more. But as of yesterday, I could honestly say that the pain is virtually gone. The only issue is my very limited mobility. Again, I'm trying to keep my arms close to my body, not, you know, move too much, not exert myself, and give myself just the best chances of recovery and a really nice result. So yeah, there's been other development in the meantime, but I'm going to save that for another video. Hopefully it'll motivate me to make another video now that I'm on sick leave again. And I've suddenly found myself with all this time on my hands. But yeah, this is it for today. Take care.